If you are worried you have Lyme disease, or just like the outdoors, and want the peace of mind of knowing whether you have Lyme disease or not, there is a new Lyme screening test based on decades of research by Dr. Richard Marconi, a professor at VCU Medical Center. For more information, visit glymedx.com, that's glymedx.com, or email at info@glymedx.com.
Infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, hey everybody, this is Robert, and welcome to Outbreak News Interviews. And Lyme disease season is here. And according to the CDC, Lyme disease is the most commonly reported vector-borne illness in the U.S. And 300,000 Americans are infected with Lyme disease annually. Now, May is Lyme Disease Awareness Month, and today we'll be discussing Lyme disease prevention, some signs and symptoms, and diagnosis and treatment. Now, joining me to look at these important topics is Infectious Disease Specialist Paul Nee, MD. Dr. Nee is a practicing physician at the Danbury Hospital in Western Connecticut. Dr. Nee, welcome to the show, sir.
Robert, thank you very much for having me.
Now, Dr. Nee, you're up there in the Lyme epicenter of Connecticut, so you must see a lot of patients with this potentially debilitating disease. Can you give me and the audience a brief introduction into your experience with Lyme and Lyme patients?
Okay, yeah, thanks. I've been in Connecticut now, I can't believe it myself, about 20 years. And when I began practicing here in the western part of Connecticut, Lyme, well-known disease. And it's gone from a disease where we didn't know much about over the last 20 years to a disease that we know a lot about. And many of the practitioners now are able to recognize and treat the disease without the aid of an infectious disease specialist such as myself. So we've sort of seen that uncommon disease turn into a sort of common disease that we see here in Connecticut. And this has happened throughout the Northeast, where primary care practitioners now can recognize the disease and in most cases treat it appropriately. The other thing we've seen is with Lyme, the emergence of the other tick-borne illnesses. These have also, dramatically increased over the past 10 to 15 years, not just here in Connecticut, but in other states like New York and Massachusetts. So it's quite striking when, you see the number of patients we see with these tick-borne illnesses. We sort of joke around that we have two seasons. We have flu season and we have tick season, and we're beginning that tick season right now.
Sure. Now, and Lyme disease is not a Northeast problem anymore.
Correct. Yeah.
Only. Yeah. Can you talk about the current geographic map of Lyme in the U.S.?
Yeah. So if you go back to when Lyme was first sort of recognized, you would see that many of the cases were reported in Connecticut, New York, and over the past 20 years, you've sort of seen that disease and the number of reported cases spread west, south, north. It's a phenomenon that is probably partially related to the environment, also related to the ability to recognize the disease. Again, many clinicians now are able to sort of identify the Lyme rash, which we may be able to talk about in a little bit, or the signs and symptoms of Lyme disease, and be able to accurately diagnose that and treat that disease. So it's something that now it's not just a disease of the Northeast; it's a disease now that you're starting to see spreading south and spreading westward.
Sure. Now it really all starts with the tick,
right?
When we're talking about transmission and prevention of Lyme. And related diseases. Now, can you talk to us about the transmission and the prevention of Lyme disease?
Sure. So in the Northeast, the vector or the insect, the arachnid, which transmits the disease, is the Oxodes scapularis tick. And this tick is it has a life cycle that's 2 years, and the transmission primarily occurs through its two later stages, the nymph stage and the adult stage. The nymph stage, which primarily occurs now this time of year in the spring and early summer, that tick is very small. It's the size of a pinhead or a pencil head. It's very, very tiny, hard to see. So this time of year, the tick itself is beginning to quest. It's looking for blood. It's looking to feed, and it will feed on animals that may carry Lyme disease, such as small mice, field mice, or deer. When it feeds on that animal, it then will be able to transmit the organism, the Lyme or other tick-borne illness organism, to humans when it feeds on a human. So this is the time of year where people may get bit, and then they may not even know they get bit because the tick itself, the bite is often painless. The tick saliva has anesthesia in it, which allows it to feed without feeling the bite itself. So it becomes very important that people are cognizant of the time of year, where they are, in order they can prevent this disease. And certain little things one can do when you're out in wooded areas or you're doing gardening, wearing long sleeve clothing, bright clothing that you can recognize potential ticks that are on your clothing, utilizing insect repellents or insecticides on clothing. Insect repellents such as DEET or permethrin on clothing can prevent these ticks from feeding on humans or feeding on us. The other things that one can do is the environment around your household. You can modify that so it's not tick-friendly. Things like using gravel between wooded areas in the lawn, keeping your lawn cut low, are very simple measures that can cut down on tick abundance in the yards. Other personal protective measures include the use of doxycycline. If a tick bite does occur, you can take a single one-time dose of doxycycline that is about maybe 70% effective in preventing Lyme. Not 100%, but if you have been bitten, you can take this, and the tick usually needs to be on you at least 36 to 48 hours, and you should be sure that it's a deer tick. But if you're able to take the medication, it can be effective in preventing Lyme in the future. The other thing,
Dr. Nee, how quickly do they have to take that?
Usually within 72 hours after tick removal. So, and it's very important also that you make sure that you don't actually have Lyme disease at that time, and that would be manifest as a rash at the site. So, usually, if you can identify, that it is a deer tick, Oxodes scapularis, and you get it off with taking doxycycline within that 72-hour period of time, can be beneficial.
Up there in your part of the country and in your practice itself, how common are you seeing co-infections with Babesia and Anaplasma and Anaplasma?
Yeah. So anaplasmosis, which really emerged in this part of the state back about 2001, 2002, has become widely prevalent. In fact, already we've seen cases of patients, both inpatient and outpatient, contracting this disease. It's become very common. Oftentimes, we will see people that are co-infected also with babesiosis. Babesiosis tends to occur later in the year. This is a parasite that, again, it can be transmitted by the same tick and can cause severe disease and hospitalization in many patients. So it's become very common for us to see, people having two tick-borne illnesses at one time. We're fortunate in that some of the antibiotics do overlap, so with treatment, you may be able to treat with anaplasmosis and Lyme, you may be able to use a single antibiotic to treat that. Babesia becomes a little bit more difficult because it is a parasite, and the antibiotics don't necessarily overlap in that situation.
Okay. And now, are there other ways to contract Lyme besides a tick bite? I've seen studies that suggest sexual transmission, et cetera.
Yeah, there's been, as of right now, there's no other proven mechanism other than a tick bite in which Lyme disease is transmitted. There's concern, of course, about sexually transmitted. There's also been concerns in regards to transmission through breast milk, that's not been proven, and even transplacental passage of the organism. In other words, if a pregnant woman to pass on to her child, there were some initial studies that suggested it. There's been some subsequent studies that have not shown that. I personally have treated a lot of pregnant women and seen their children have no adverse outcome related to Lyme at all. So I think it's something that, again, we're still studying, but right now the only real form of transmission is that of through a tick. And the other thing you have to remember is Lyme disease tends to run in geographic areas, in towns and other things. It's not uncommon that we might see multiple family members infected with Lyme disease. Why? Because they're out in the same area. The animals, such as the field mice, may have Lyme disease that are inhabiting that area. So it's not uncommon that we might see it among, husband and wife, or a mother and a child, something like that.
All right, let's switch gears to signs and symptoms.
Sure.
There are, many symptoms that you may or may not see during the early stages, and again in what they call the chronic stages.
Right.
Can you talk about this?
Yeah. So first of all, approximately 50% of people who develop Lyme disease never remember having a tick bite, and I think that's an important aspect. Mm-hmm. Later stages of Lyme often can manifest weeks to months after the initial tick bite. But in the very early stages, if a tick bite, well, first let's go back. How long does it take with a tick bite to develop Lyme? As I mentioned earlier, the tick needs to be feeding for at least 36 to 48 hours. The whole process is a long process to transmit Lyme. The Lyme, at the site of where the tick bites, in the majority of patients, a rash will develop. Not all patients, but a majority of patients. That rash is a usually spreading, rounded red rash, which may be associated with fevers, body aches, and flu-like symptoms. Now, they could be in areas where typically people may not look. The back of the knee, in the gluteal or buttocks area, underneath the arms, the nape of the neck. So oftentimes if there's flu-like symptoms, if the clinician or doesn't look, they may miss that rash. And it's important for patients really to recognize or see and make sure they don't have that rash. Now, we often talk about the bullseye rash that occurs, which is if you look online or see, it's a sort of reddened area and then an area of clearing white and then another area of redness. That can occur, but more commonly, just erythema or redness may occur that slowly spreads over time. Now, if that goes unrecognized, weeks to months later, you can get later manifestations of the disease. Things such as facial palsy, where the side of the face becomes paralyzed. People in later summers develop things like heart block, where the heartbeat goes low. Sometimes you can develop a neuropathy, painful nerve stimulation or shooting pains that are quite severe. And then later, months later, you could develop a Lyme arthritis, where the joint, one of your joints, typically the knee, will swell. It often swells without any trauma and can be associated with fever sometimes or other joint aches. And then even later, some people might develop what's called a Lyme encephalopathy, or late stage, where it can be manifested as some subtle neurocognitive findings, fatigue, memory issues that are again often seen months afterwards, and that can happen the whole spectrum. It's funny, the later stages of Lyme, such as the Lyme arthritis, we see most cases in January or February, because the organism has been dormant in the body, and then sort of the immune system wakes up and they may develop that immune response and a swelling in their joint.
So are these people with these later stages, are these people that just never got treated early on? Yeah.
They've never got treated, exactly. They've never got treated early on. So if you catch Lyme very early, you can prevent these later manifestations of Lyme disease. And that's why it's very important to take those personal protective measures we talked about earlier. Or if you do have a fever during summertime and a rash, see a clinician and make sure that you're not dealing with Lyme disease, because if you treat it early, you're going to prevent those later manifestations.
Yeah, and you talked about the bullseye rash.
Right.
And a lot of people think that's like the gold standard, but that's not seen in nearly 100% of people.
No. In fact, I had a patient last last summer who recognized a tick bite. We watched for a rash, but within 2 weeks after this tick bite, developed a fever and up to 103, 104, but never developed a rash at the site. And we were later able to prove that it was Lyme disease based on blood work. And that person did get treated very early on because of the history of the tick bite, and did very well and never manifested anything later.
Now, we could piggyback on that concerning the blood test.
Right.
Now, the diagnosis and treatment has been very controversial for many years.
Right.
Let's go ahead and start with diagnosis. Dr. Need, do we have a problem with the currently available diagnostic procedures? Can you talk about that?
Yeah, so one of the things early on, and one of the controversies exists around Lyme testing, is very early in the disease. After the tick bite, it can take upwards of a month for people to develop an immune response. And that's what we look for in the blood. We're not looking for the actual bacteria. We can't culture the bacteria readily like we do other bacteria. It's like things like E. coli or staph are easily culturable in blood cultures. But Lyme, Borrelia burgdorferi spirochete, is very difficult and time-consuming to culture out. So we rely a lot on the physical findings, the history to make that diagnosis very early on, and not rely on the lab work. So it's very important, like that patient I mentioned earlier with the tick bite, that we were able to treat that person very early on to prevent the later manifestations. We relied on our clinical findings and history to make that diagnosis. Later stages, the serology is good. Now, again, it's not 100%, but greater than 90% in most of the later cases, and closer to 100% in maybe Lyme arthritis. So as you go along in later stages, the immune response does exist, and it can be diagnosed. But yet there are some people that may still slip through. The upcoming IDSA guidelines are looking at the current two-tier test that we use as being the gold standard, and reviewing it again as part of the new guidelines that hopefully will come out in the next few years. There are, I must say, on the other side, there is a lot of other in-house laboratories may make their own in-house diagnostic tests. Those have not been vetted or proven to be gold standards for making the diagnosis. So it's very important. The CDC has made a statement about this, is that they really want to rely on this two-tier testing right now to be the gold standard, particularly for later stages in the disease.
Do you see any other types of diagnostics coming out in hopefully the near future that will be better than what we have now?
Yeah, there's been a lot of, even at our institution right now, we're looking at other mechanisms and other ways to make diagnostic, to make the diagnosis of Lyme. And I think we're a few years away, and I think we'll have to see what ends up happening in terms of these to make the diagnosis, particularly early on. And making an accurate diagnosis becomes very important for people too, because one thing we often see too is some people are maybe diagnosed with Lyme and have other diseases, and it may not be based on it may not be based on serologies from other labs.
So is PCR not a viable option?
PCR is excellent diagnostic tool for Lyme arthritis. It can be utilized, and I've seen it in some studies in early stage disease, but doesn't become practical because at most of the time where people have early stage disease, it's readily recognizable with a rash. PCR on spinal fluid has been utilized in certain circumstances, but again, we rely much more on the immune response right now for that. But there is more technological advances, and understanding of the immune system, I think, will also help us, particularly T-cell and cell-mediated immunity will help us understand and make the diagnosis more readily in the future.
Now, treatment is another bone of contention.
Yeah.
What, in your view, what is the appropriate treatment regimen for Lyme disease?
Well, it's very clear. Early stage Lyme disease, a rash, let's say things like a Bell's palsy, they can easily be treated with an oral antibiotic regimen. Bell's palsy, if there's no signs of meningitis, can be treated with with an oral regimen. But later stages of the disease or central nervous system manifestations usually need to be treated with intravenous antibiotics for a longer period of time, sometimes upwards of a month of therapy. The problem becomes is the people who have, or the patients who may have symptoms with after treatment for Lyme, they don't feel better. They still feel fatigued. They still feel tired. Their joints may hurt but not swell. They may have neurocognitive complaints. And they've truly had Lyme disease. And there are some people that get Lyme and they just don't feel well afterwards. And so that's been one of the bones of contention, right? They're not getting better, and those people
exactly. So what explains that?
Yeah, it's a great question. There's been some studies about immune response, and there may be an aberrant immune response, and various levels of cytokines and interleukins may be aberrant afterwards. It's hard to know exactly what is going on, because not everyone's a little bit different in terms of their immune response, because I can have people who have Lyme disease and later stage arthritis and they do completely fine, and I can have other patients that get very earlier stages are caught very early, but yet can have chronic manifestations of tiredness and easy fatigability and the neurocognitive complaints. And it's hard to know or what the explanation is for that. And I think that's one of the things that in medicine we've been looking for over the past few years, is to find those answers. But one thing is clear is, looking at these patients in multiple studies, that long-term antibiotics followed by oral antibiotics appears not to work. Despite wanting it to work for many patients, it doesn't appear that it's beneficial. Now, there might be some studies that show that there's some improvement in fatigue, but it may not be worth the risk of being on long-term antibiotics, particularly when the side effects of long-term antibiotics may be deleterious, changing the microbiome, which is a new and expanding area of infectious disease and science. The side effects of the medications themselves with catheters in the bloodstream can lead to other bloodstream infections. Some medications can lead to development of gallbladder, gallstones. And there's even been unfortunately some deaths with this long-term treatment of IV that have been documented with no proven benefit. So I think symptomatic treatment becomes very important for these patients until we can exactly figure out what can get them better. But until we have a clear science behind this, doing something which may be dangerous to the patient is not warranted, particularly with all the data we have now about the long-term antibiotic utilization or usage in this disease.
Okay, sure. Now, like I said in the intro, May is Lyme Awareness Month, and Dr. Nee, can you discuss the importance of this month, and as an ID doctor, and to the public in general?
Yeah, I think one of the things is, in many of the patients I see, they often are regretful that they didn't take the personal protective measures, and these are very simple things we talked about. Using insect repellents, checking yourselves for ticks after going out for hikes. They're very easy things to do that can prevent the disease. So I think one thing is, it's a very preventable disease if you take a couple little extra steps before you might be going on that hike or doing an extensive amount of gardening or things. The disease is very treatable in the early stages. And that's, and people respond very well if we can catch it early. So I think it's important that people be aware of it. If they do have those fevers, look for the rash, look for the tick bite, and make sure you get to a clinician to be able to make that diagnosis and get you treatment right away. And I think the other thing, too, is for a lot of people, they often hear horror stories. Listen to your clinician. Don't listen to the person you run into at the grocery store. This can be a very treatable disease if caught early, and it's very preventable.
Okay. Any final thoughts?
I think the other thing that people need to be aware of, there are other tick-borne illnesses out there, and we do talk about Lyme, the tick needing to be attached for long periods of time, but things like anaplasma, babesiosis, they may not need to be attached as long. There are other tick-borne illnesses out there that we need to be cognizant of. And these are things that are emerging, and in science and medicine, we're always learning new things. When I started here, we rarely would see cases of anaplasma or babesiosis, and now they've become very common things. So, and treatments change, and understanding of diseases change. So, I think people need to be aware of that and need to know that we can prevent these diseases, and they're very treatable if caught early.
Okay. Well, I want to thank you, Dr. Paul Nee, for your time and expertise on this Lyme Awareness Month. Thank you, sir.
Okay, thank you.